Okay, he's 27. He's professional. He's a right-hand pitcher. He's had 1 week of shoulder discomfort. He says it's anterior and superior. He says his arm is tired. It's in the middle of the season. His shoulder has been good essentially for his career. I'm not going to give you all the information. It's just the positive stuff. You're not going to get every imaging scan. But just going down the list, Lee, what do you got on this MRI scan?
Starting at the top, you have a little bit of inflammation in the bone, edema in the bone at the AC joint, which is typical at that point in the season. You have some changes in the rotator cuff. The humeral head has a little bit of edema, but I don't think that's anything. There on the glenoid itself, it looks like you may have some articular changes. And then we don't really have the cut for the superior labrum. You do have changes and chronic thickening of the capsule going into the humerus.
Okay, so it's got a lot of adaptive stuff. So MRI, they show a lot of things. What's impressing me right now is this area right here. I'm going to go into his exam. Okay, Tom, what are we testing here? What is this suggesting?
Well, you're testing his cuff strength, and then an abduction like that with pain. For me, that's a test for impingement, bursitis.
Did he have pain, Chris, or just weakness?
You covered his face, so I couldn't see him grimace.
Yeah, yeah. He's got pain, and he's got it's anterior superior shoulder pain. And he's got discomfort, and
I guess I meant, did he have pain on that particular test?
yeah, he's making faces, and he's got pain.
Okay.
Yeah, sorry about the non-disclosure of the facial expressions. All right, so who wants to give a diagnosis? There's nothing complicated here. George, go ahead. What's wrong with this guy?
And he's got what I would call a cuff strain and some subacromial bursitis and a partial thickness tear or tendinopathy. I don't see anything here different.
Okay, what would you do for this guy? It's June, and he's had 1 week of symptoms, and he's a reliever, and he's extremely motivated to pitch.
Medrol dose pack followed by anti-inflammatories. I would consider a subacromial injection, and I would do a careful assessment of his overall sort of kinetic chain and address any deficiencies. Obviously, some rehab.
Okay,
George,
I like that.
Why the Medrol dose pack instead of just the NSAID, out of curiosity?
It's partly experiential. I've seen guys respond, I think, quicker and better to a 6-day Medrol dose pack followed by diclofenac or anti-inflammatory of your choice than with straight anti-inflammatory. So it's really
Tom,
just
you've
been
never had a
experimental.
Medrol dose pack, obviously.
I've never had one. We do use them. Not
They work.
You should try one. I had a dose pack. Not only do you feel good, your mood elevates. It's like it's really. But we think of them in tiers. It depends how aggressive you want to get, including from NSAIDs to dose pack to the next thing, which is, okay.
Chris, I'd actually like to ask a quick question. How long has he been shut down yet, and how long has he been shut down for, and how long can you backdate his DL? Because those are going to potentially be impactful as part of where are we in the season. That's a part of managing these individuals in the middle of a season. So I think that will have an effect. And I agree with Tom. I don't necessarily go right to a dose pack either, because there is a restriction on how many of those we may give the guy in a season. And again, depending upon the athlete and how well we know them and how often we may have to go to the well on these things, will we or will we not need that again in the future? Are we going to be in the postseason? Are we going to need to give them
it's mid-season. It's June.
No, I know that.
Right?
But
let's
is this a guy
let's get through
that
the
you've
first
managed
case,
before?
but
again, these are.
but I like that everybody had a good break.
Coffee.
But
no caffeine on me.
But just to simplify
You're on a dose
variables
pack.
for a second, instead of expanding the variables of his free agency, all the things that are coming up in the season, just to ease into it, diagnosis, a little bit of treatment, and then we'll get going with everything. But you're right, seasonal timing's a big deal, and I agree. We definitely have to be cautious about when we unload treatment and when we don't, especially if we're going to make it to the postseason where you want to be peaking. Anyway, I'm going to go back to this video. Who can predict what happened? This is about 7 minutes later.
You did a diagnostic injection, and his strength is good.
Yeah, we did a subacromial injection, and so all the things about the labrum and the adaptive changes and stuff. The point of this case is it's not unusual to get rotator cuff weakness from a rotator cuff process with pain, discomfort, and so forth. And I do a lot of subacromial cortisone injections, and I don't know what a lot is because I want to know what a lot is compared to you guys. So just going down the list quickly. Lee, how many injections would you do on baseball players in the subacromial space in a given season? More than 2? Less than 10?
10 to 12.
Okay, how many, Tom?
More than 2, less than 10.
Okay.
Talking about for my major league team, or are you talking about any baseball player?
All right, tell us both since you already wasted a whole sentence. waiting to say.
Less than 6 for the major league team.
Okay. All right. Schick, anything else on that?
Probably maybe 2 before and 2 after the All-Star break.
All right, my assistants are here. I usually have 10 injections pre-prepared for every office hours. Not all of them are going in the subacromial space, but at the major league level, probably around 10, with including actually not major league, professional levels, somewhere 10 or less. So that's a decent amount. And the reason that I think it's helpful, you guys can chime in now, is it's diagnostic in addition, and it's therapeutic. Diagnostic and therapeutic. I like those two things. So he, I don't want to belabor this. This guy gets back, and let's call it quick. He's throwing within a week. A guy who's that weak, to have him throwing in a week, he had such a good response, and our training staff is really good at knowing when someone's ready to start throwing, objective parameters, strength, symptoms, etc.